Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. And today I'm going to talk about dark circles treatment with hyaluronic acid. This patient came to my office. The patient really don't know what the problem is with the lower eyelid. She don't feel good, and the question is this area, the lower eyelid have a long distance from the tarsus to the malar area. The lower eyelid cheek junction is very low. This length make the patient look like a dark circles. Here we can see the tear through, the pressure here, the long distance, and the lower eyelid cheek junction very low. The best treatment for this kind of patients is the filler of the malar area. With the filler of the malar area, we are going to improve not only the dark circles, we are going to shorten the distance from the tarsus to the lower eyelid cheek junction. And one sign of the beauty is no transition between the lower eyelid and cheeks. Here we can see the preoperative patient, and here immediately after I put one syringe of hyaluronic acid here and the other here. We can see how improved the malar, the volume of the malar is nicer than here. Also we can see the shortening of the lower eyelid. The lower eyelid cheek junction is very high. The distance from the tarsus to the lower eyelid cheek junction is very short. And also the malar is the lower eyelid also is like a continuation with the malar. Here we can see completely different. Here is I put geometry to understand much better how I produce a shortening of the dark circle. I improve the malar area and I improve also the lower eyelid, and also improve the tear through channel. Here we can see how was improved. Another lateral view. Just a simple procedure without pain, without downtime, and just one procedure improve several factors. Improve the tear through, improve the malar, and improve the lower eyelid, also improve the dark circles. This hyaluronic acid is going to last 20 months and also stimulate the collagen. Here we can see another patient. We can see the flattening here and how improve the malar area, how improve the lower eyelid. The lower eyelid cheek junction is here. The lower eyelid cheek junction is here. This is a flattening and this is very nice. Here is the tear through, and here we can see how improve the geometry to show Okay, I hope you enjoyed this presentation. Have a nice day.